We are live. We are live. I'm Dr. Frita. Welcome to Dr. Frita Live, where we talk about the latest trending medical headlines and celebrity health news. Today will not disappoint. We'll open up talking about Christopher Kid Reid. You know him. This is Kid from Kid and Play with the high top fade. Yes, he got a second chance at life because guess what? He got a heart transplant. We'll talk about it, what the indications are for a heart transplant, and what risk factors you might have and not even know it. And then we will talk about with the star of Sanford and Son. You remember Lamont, Red Fox's son? Well, he passed away, actor DeMond Wilson, from prostate cancer. We'll talk about prostate cancer. We'll talk about how it disproportionately affects Black men and what you need to know about screening and prevention of it spreading and getting too far. Then we'll play my favorite little game, Myth versus Fact. And with this, we will honor actress Catherine O'Hara, the Home Alone star, among many other things. Well, she passed away, and she actually had a condition called dextrocardia with situs inversus. Yes, her heart was actually on her right side. We'll talk about it. And then we'll move into even more trending topics where I'll give you a fresh take you simply can't get anywhere else. We'll talk about Real Housewives of Potomac's Karen Huger, because she had quite the striking interview with Andy Cohen where she's talking about her recent time in jail, yes, and dealing with living with alcohol overuse, with addiction to prescription medications. And so we'll talk about some of the complications of alcohol overuse, and then we'll weigh into accountability and what you think when it comes to Karen Huger. Does it make a difference? We'll see. And then we'll talk about T.K. Carter, comedic actor who passed away at the age of 69. Afterwards, we'll talk about a few more medical stories, including a young girl, 7 years old, who overdosed on her mother's GLP-1 injector. Yeah, a 7-year-old girl overdosed. I'll tell you how she ended up doing. Now, you know we're live, so you can ask me questions. I'll ask you questions. Go ahead and hit the like, subscribe, follow, because this is about to be an evidence-based medical show that is fun and filled with facts that will help you live your healthiest life. It's Dr. Frita Live. Let's get started. We are live. I'm Dr. Frita. This is Dr. Frita Live. Listen, we have a power pack show, so I hope you brought your brains, your engagement, and your willingness to learn and to share knowledge as we get going with this Medical Monday. Of course, I'm not doing this alone. Will my co-host and office manager please come to the front of the stage? Shador, how are you doing?
Hey, good, Dr. Frita. How are you?
Doing well, doing well. Now, did you watch the Bad Bunny halftime show? Did you watch alternative halftime shows? Did you enjoy the Super Bowl? How was your weekend?
Weekend was okay. Did watch the halftime show, the official Super Bowl halftime show with Bad Bunny. No alternatives, no complaints here.
Yeah, I enjoy it. It's getting mixed reviews, I see, but hunty, me encanta Bad Bunny. He got out there and he represented the culture. He let y'all know, me llamo Benito Antonio Martinez Ocasio, and he was just started going off. He had all the Afro-Latinas, ellas están bailando, and my kids were complaining because I tell you, I allegedly can be slightly obnoxious when watching halftime shows and things I enjoy, but I purposely tried to contain myself, you know, and like not jump in front of the TV and not scream and allow others to enjoy. I tried, Shador. I tried, but the teenagers kept saying, "Ma, you're doing too much." But I can't help it if I had to do a little bit of the salsa and merengue when I saw Cardi B and Jessica Alba and all of them. I couldn't help that. So I really enjoyed it. I really thought that it was an homage to the culture, because we know that he actually got a lot of death threats. Bad Bunny did. You have people, specifically Trump, you know, he's outright said it's no secret. And then his many of his followers, you have the MAGA folks who just openly said that this was un-American because he did speak Spanish during the show. They actually offered an alternative show that they called the All-American Show with Kid RHOP, who actually has lyrics that are coming up. I remember these lyrics too, where he was outwardly in his song talking about dating underage women. That's not alleged. Okay. Hello, Kid Rock. So Bad Bunny actually started getting death threats, people saying this wasn't American. And instead of, backing away from his culture de Puerto Rico, he leaned into it. He opened up with the sugar cane, with all types of people doing some of the traditional work. He just really represented the culture, and the different businesses he had there, I later learned, were real businesses he brought over to support. He had the boxers there. He had all shades of the Latin community. So you had your Afro Latinas and Afro Latinos. You had the ones with skin that was blanco. All of it. So his show was very intentional, and he leaned into the culture of Puerto Rico, which is a part of the United States. Okay, Puerto Rico es en los Estados Unidos, and so when people want to say that Spanish culture is not a part of our culture, but then they also go and enjoy all of their Mexican restaurants and their Puerto Rican food and their salsa merengue, I think that if you don't appreciate one's culture, you should not be allowed to enjoy it. But anyway, I certainly should be allowed to enjoy it because I sat up here, I did the salsa, I did the merengue, I did all the things, and my teenagers are mad, but they'll be all right. Now, on that happy note, because I want just a nice little reminder to everyone, dancing, okay, according to a 2003 study published in the New England Journal of Medicine, if you dance, then you may reduce your risk of dementia by up to 76%. Yeah, there was this 21-year longitudinal study showing that the people who danced had a reduction of 76% in their dementia as far as the association. If you were a regular reader, your reduction was something like 35%. And then if you did crossword puzzles, it was something like 47%. Anyway, different activities to engage in to reduce dementia. So I'm talking about dancing, but it is medicine related. Okay. I should never get dementia how I be dancing. But anyway, who's in the chat? Hey, y'all. Did y'all enjoy the Super Bowl? Who's the first one in the chat?
Absolutely. The person in the chat today is Miss Aileen.
I'm Miss Aileen. Welcome, welcome. Y'all, please go ahead. Be sure to give us a like and go ahead and hit share. It lets YouTube know that we're here and giving evidence-based information. All right. Well, let's go ahead and get this thing rolling, Shador, because as always, we have plenty of medicine in the headlines and celebrity health news to cover. So let's start off talking about Kid from Kid and Play. Christopher Kid Reid. Listen, y'all already know Kid and Play. He was the star, of course, of Kid and Play, that album Too Hype. He was in House Party, and he was the lighter skinned one with that high top fade who always gave us comedic relief. Well, we have now learned that last year he presented to the emergency room with some shortness of breath, some fatigue, and he was diagnosed with congestive heart failure. Okay. So then they sent him home, had him to do follow-up in 3 weeks after giving him medication, treatment, a treatment plan. 3 weeks later, when he got back, he was extremely symptomatic, very swollen, so much so that they ran tests. They found that he had some evidence of organ failure. Okay, we can talk about that. And then he immediately got admitted to the ICU and placed on the heart transplant list. Literally, 8 days later, he got a heart transplant. And so we'll play this clip. And then MedHeads, I want to ask you, what do you think some signs and symptoms are of heart failure? Okay. And put a heart in the chat. Signs and symptoms of heart failure.
After performing for nearly 4 decades, Reid was surprised when he started slowing down.
Take us back to the beginning. When you first started to experience some symptoms. What were you experiencing?
Maybe over the last year or so, just started to feel a little bit more fatigued than before. And then when you feel like that shortness of breath, sleeping a lot more than normal. And I think sometimes you kind of just chalk it up to, I'm getting older, the road is harsh, doing the old kick step, you know what I mean?
This past July, Reid's symptoms began to intensify, pushing him to go to the emergency room for answers. It was there that doctors gave him a surprising diagnosis.
The doctors tell you have congestive heart failure.
Congestive heart failure. That's correct.
But when you hear that, congestive heart failure.
Yeah, that's
are you thinking, no, not me?
Exactly.
Initially, Reid was treated with medication, but at his 3-week follow-up appointment, his cardiologist grew more concerned.
He came in very swollen again, and that is a little unusual in somebody who's been started on treatment for the swelling to come back that quickly.
That evening, Reid had planned to fly across the country for a performance. His doctor, urging him not to go, ran additional blood work.
The blood work confirmed my suspicion. It showed that his heart was failing and it was starting to affect his other organs.
Then they called back a couple hours later and said, you know what, we got these other tests back. You need to come to the emergency room right now.
When you went in, they took you right to the ICU.
Right, because I guess they, with these latest test results, they saw something that required that kind of immediacy.
That's when doctors told Reid that a heart transplant was his only option, immediately placing him on a transplant wait list.
So when we think about status for heart transplant, he was very high on that list because of how ill he was and really dealing with a kind of life or death situation.
All right. So Kid and Play, Christopher Reid had a heart transplant. At this point, it's been a year and he seems to be doing very, very well. And so we will get back to that question. But remember, I want you to put a heart in the chat and give me some signs and symptoms of congestive heart failure. Congestive heart failure affects many people. In fact, it affects 6.7 million Americans. And the trick is, a lot of times this heart failure can be silent, or people can dismiss the symptoms, which he did. He shared that he had fatigue, he had shortness of breath, and he's like, maybe I'm getting a little older. Those can be kind of non-specific symptoms, but we'll get into the even more specific symptoms. But very importantly, I want to talk about the risk factors for congestive heart failure. A big one is high blood pressure, hypertension. And y'all know that I'm a board certified high blood pressure specialist, kidney doctor. And I can tell you high blood pressure, uncontrolled, can lead many people to having a stress in their heart, because if your heart has to pump against a high pressure, then that muscle can eventually get weak and you can get congestive heart failure. So what is congestive heart failure? It does not mean that your heart has failed, as in, boom, you flatlined and it stopped working. That's not what it means. It's just, so the term, I don't love the term congestive heart failure, because what it actually means is that the heart is just not pumping as efficiently as it should be. And so when you think about with each contraction, your heart is supposed to pump a certain amount of blood out, okay? Give you a good ejection fraction, 50 to 70%. It's supposed to have a good pumping. If it does not, and you don't pump out the right amount of blood, then you can have a backup of blood that causes you to have fluid in your lungs, cough, shortness of breath. It can cause you to have fluid in your legs, your feet, your ankles, even in your abdomen. And it can lead to just worsening function where your body's not getting proper oxygenation. Okay, so you can have systolic heart failure, so the heart's not pumping as strongly as it should, or you can have diastolic heart failure, the heart is not relaxing. So how do you know, as you listen to me, if you are at risk for heart failure or not? Well, definitely if you have high blood pressure, you're at risk. Also, if you have diabetes, certain congenital conditions can do it. If you've had chemotherapy, specifically chemotherapies that are used in some cases to treat breast cancer, doxorubicin, adriamycin, these can cause a dilated cardiomyopathy, okay? Certain infections can do it, like Coxsackie virus or other viruses can cause an inflammation of the heart, myocarditis, and that can lead to a congestive heart failure. And coronary artery disease. So if you have blockages in your heart vessels, okay, or if you've had a heart attack, and so some of the muscles in the heart are no longer alive, we call it myocardial infarction, heart muscle death. And so if you get a death of some of that heart muscle, then it makes sense that it's not always going to pump as strongly as it should. And so having previous heart attacks could be a risk factor for congestive heart failure. Many things. If you're an older person, okay, you can be at high risk if you're older than the age of 60, older than the age of 65. So multiple things can put you at risk. Very commonly, we see the high blood pressure. And as Christopher Kid Reid really put out a call to action, he said, especially to his people. And I'll tell you that Black people are disproportionately affected by high blood pressure, which stands to reason that a great percentage of us will get congestive heart failure. So the key is to pay attention to your body, pay attention to the symptoms, which you're about to get into, because if you develop end-stage congestive heart failure, Okay, and there are 4 stages. If you develop end-stage congestive heart failure, where you start having symptoms at rest, and despite medications, lifestyle modifications, if you're still having these severe symptoms at rest, then you could be a candidate for a heart transplant if it gets to the point that none of our medicines are working for you. Also, if your heart failure takes you to the point where your life expectancy is only 1 to 2 years, that could allow you to be a candidate for a heart transplant. And I'll tell you, we're talking about Christopher Kid Reid of Kid and Play. We're getting funky. Y'all used to love that song anyway. But we're talking about him. But there's a younger person, who's had a heart transplant, the son of a Real Housewives star. And so let's put that heart in the chat as far as what are the signs and symptoms of congestive heart failure. And then I want you to put a star emoji if you can tell me someone who's the son of a Real Housewives star, what son actually had a heart transplant. Okay. So let's see who all participated. Medheads, wake on up. Now, what y'all did? I hope y'all didn't stay up too late from Super Bowl. Let's see who's awake here today, Shadora.
We have Esther.
Hi, Esther.
Esther says fluid retention. She joined us from Facebook today.
Hey, welcome from Facebook. Good. You'll see I did a few posts over there. I did a couple over there on Facebook. But thank you for being here. Yes, fluid retention, absolutely. So if you have heart failure, heart's not pumping out as strongly, you get a backup, right? And that backup can lead to retaining fluid, which shows up as swollen feet, swollen ankles, swollen legs, and it can be shortness of breath because you might have fluid retained in your lungs. Very good. Come on to the front of the class.
All right. Mister.
Hi, Mister.
Mister says always fatigue.
Fatigue, absolutely. Chronic fatigue will do it for many reasons. Yes, that heart's not pumping, and your blood carries your oxygen, and so if your body's not getting oxygenated, the brain is not getting oxygenated properly, plus you have shortness of breath, you'll be tired all the time. Extreme fatigue. Very good. You come on.
All right. YouTube butterflies.
Hello, YouTube butterflies.
Says pitted edema.
Very good. So you can get pitting edema. And so one way to check for that, and look, y'all can do it yourself at home. If your legs or your feet look swollen, just take your fingers, press in, hold for a few seconds. And then when you lift your fingers, if you still see the pits or the indentation of your fingers, that's called pitting edema. And yes, absolutely, that is a sign of congestive heart failure. Very good. All right, Medheads, good morning.
And as far as the Real Housewives star, a couple of people chiming in, Mr. and Yolanda, they all said Nene's son Brent leaks.
Come on up. You got it. Yeah, Brent leaks. And I pray he's still doing well. I know Nene shares some, of course, we respect her privacy. And so I only know what she shared publicly. But we know that he had heart failure severe enough to the point where he had the transplant. And he was open as well. He put it on his page and Nene shared, and she talked about it in interviews. I believe she even shared that she's had job opportunities that she's turned down. It might have been Trader specifically because of some up and down, sensitivities with his health. But even as a young person in his 20s, he had heart failure severe enough to require a heart transplant, which thank goodness he did receive. But if you pay attention to your body, pay attention to your symptoms, like the symptoms that y'all shared, then the key is to try to catch it before it gets to a severe point. Because the very first stage A of heart failure, is actually pre-heart failure. Before you ever have any symptoms, if you have risk factors like family history, high blood pressure, diabetes, and you're identified as being at a higher risk, then your physician can put you on a track to try to prevent you from getting to congestive heart failure. So the key is not to wait until you have symptoms, but to get routine care with your primary care doctor. And also, if you do get symptoms, please don't ignore them. Don't dismiss them. Don't say, I'm just getting older. That's why I like the message that Kid shares, but just go in and love yourself enough to take care of yourself. Love your loved ones enough, the ones who need you, to take care of yourself. Prioritize yourself.
Yeah,
all right.
I'll read a couple of questions surrounding this particular topic. Okay. Jason asks, is constant shortness of breath a major red flag?
Absolutely. Now, many things can cause constant shortness of breath. Yes, congestive heart failure can do it. Severe anemia can do it. If you have something like a pulmonary embolism, little blood clots that are keep maybe flickering off from clots in your legs, that can cause a constant pressure. Certainly, if you have some type of a severe chronic illness, even if you don't know about it, something like a malignancy, a cancer, an autoimmune disease like lupus. Now, I'm not speaking this onto anyone's life, but I'm just talking about things that can cause severe shortness of breath or constant shortness of breath. If you have lung disease, be it asthma, bronchitis, emphysema, COPD, these things can do it. Pulmonary hypertension can do it. And interestingly, many people who have heart failure, systolic heart failure, will develop pulmonary hypertension. That could certainly lead to you having a chronic shortness of breath. So there are many things that can do it. The key is you don't want to sit at home. You don't want to guess about it. You don't want to say, oh, maybe I just need some more rest. Maybe I just need to take some vitamins. You know, even coronary artery disease, heart vessels disease can cause you to have it, abnormal heart rhythms like atrial fibrillation. I could go on and on and on. But the most important thing is to find out the cause of the chronic shortness of breath. Okay. So if you're talking about yourself or a loved one, please call that loved one, or for you, call your doctor and ask for an appointment, share. And if this shortness of breath is severe, you know, if it's debilitating, then you may need to go to the ER. Okay. You may need to go to the ER if you know good and well that you're having extreme shortness of breath. All right. Good luck to you if you're asking about you, and for everyone else, we can all benefit from that information. So thank you. All right. Who else had a question? Oh, I don't hear you, Shador.
My apologies. I see you, girl. She says,
I see you, girl. I see you too.
Will a stress test reveal this?
Well, a stress test can help to reveal if you have coronary artery disease. So there are different things that can reveal it. So one, an echocardiogram. So the same way pregnant women get ultrasounds or sonograms to see those pregnant bellies, you can get a sonogram of your heart. So they'll have you in a room that's a little bit dark, put a certain gel, like jelly, on your chest, put a probe and just look. And on the TV monitor, you'll see, you know, an image of your heart, and it will let the doctor know how strongly your heart is beating, if it's relaxing properly, the function of your heart valves. But the echocardiogram is one way to diagnose congestive heart failure. Also, cardiac catheterization, where dye is shot into your groin artery or an artery in your wrist, your radial artery, and they can actually look at not only your heart arteries, but they can get an idea of how strongly your heart is pumping or how well your heart valves are working. That can give them ideas as well. A stress test is designed to let us know if you have a high risk for a heart attack. Like once your body is stressed, either by a chemical, like something that's injected into you that gives you a stress, or by running. Once that happens, do you get EKG changes? Do you show signs of ischemia, meaning that does running, you should be fine when you run, okay? You should be fine when you run. But if running causes your heart vessels not to be able to give proper amounts of blood to sections of your heart, okay, if you have ischemia or stress from the stress test, that lets us know if you have a high risk of a heart attack, or if you have poor blood flow, or if you need to have the next test to see if there's actual blockage in your heart vessels that might require a stent, or like putting a little straw in there to open up the vessels. But yes, stress test is one of the tests, but I recommend seeing your doctor, and a cardiologist have indicated to do all of the proper workup to see if you're someone who has congestive heart failure.
All right.
These are good questions. Anybody, I really love questions. Okay. I like to ask them too. Okay.
Now, Alice. So not a question, but she says, hi, Alice.
Hi, Alice.
She says, fibromuscular dysplasia I was diagnosed with. Now I have heart failure.
Oh my goodness. So that makes me wonder if you have like some type of a predisposition to, having issues just with your muscles, including your heart muscles. So I'm sorry that you have that diagnosis of the congestive heart failure. One good thing is that now, as we get advanced in technology, there's certain treatments. And of course, consult with your cardiologist. Make sure you stay on top of what your cardiologist says. But just speaking in general, for people who are diagnosed with congestive heart failure, some of the things, low salt, okay? According to the American Heart Association, most adults should have a salt intake of no more than 1,500 milligrams of salt a day. That might sound like a lot of salt or sodium, is not. If you think about 1/4 of a teaspoon, not even tablespoon, 1/4 of a teaspoon of salt already has about 590 milligrams of sodium. So what does that mean? If you have 3/4 of a teaspoon of table salt, then you've already exceeded your daily limit. But it's very important that you limit your salt if you have congestive heart failure, because that salt will lead to water retention, and you already are at risk for water retention because the heart's not pumping as well as it should. Also, doing exercise, what's recommended by your physician, but making sure that you try to maintain the best cardiovascular health that you can. Eating a diet that's high in omega-3s, like certain things like fatty fish, salmon, halibut, mackerel, things of that nature, or you're taking, some type of an omega-3 supplement. And then there's certain medications depending on your level of symptoms or your level of ejection fraction, okay, which I definitely have videos, and we're going to get, in fact, why not? I'm going to release a video this week going into more detail about heart failure and the life expectancy if you have heart failure. And I already have videos right now here on YouTube where I talk about congestive heart failure explained. But bottom line, we have treatments that can help to slow down the progression. And I'll tell you personally, from patients I've had who've had pretty advanced heart failure with ejection fractions that are low, like Ray J's 25%, I've seen patients jump 20%. They've gone from in their 20s to their 40s as far as ejection fraction. Now remember, the ejection fraction is the percentage of blood your heart pumps out with each beat. Normal is between 50 and 70%. And if you have a low ejection fraction, then that means that you have congestive heart failure. And remember, Ray J shared that he had a number of 25%. And assuming he is talking about ejection fraction, that would mean that he had heart failure. But it's not necessarily a doomsday death sentence. You have to be proactive, okay? So make sure that if you have it, or if you have a family member, a loved one, and you're suspicious, don't let them just sit there and start planning out their eulogy. Tell them to get up, go to their doctor, and let's tackle it. Let's face it and see what we can do. Okay. All right. Oh, and while I have your ear, for those of you who are new, welcome to Dr. Frita Live. I am Dr. Frita. I'm an MD who has been quadruple board certified. So I am a board certified nephrologist, meaning I'm a kidney doctor and a high blood pressure doctor. I am also board certified in internal medicine. I am board certified in obesity medicine. And after I completed my dual residency in internal medicine and pediatrics at Georgetown University Hospital School of Medicine, I also received my board certification in pediatrics. And so I like to learn a lot. I like to read a lot. I read medical journals every single day. And even more importantly, I love to share my knowledge. And so welcome to the channel. If you're new, please give us a like and give us a subscribe. I'm telling you, I have hundreds of videos where I give you evidence-based medicine in a way that's easy to understand. And so if you're going to see your doctor and they're talking about heart disease, heart failure, prostate cancer, kidney stones, dementia, exercise, you name it, at this point, I have a video on just about every subject, thyroid disease. And what my videos do is that they give you a chance to have a basic understanding of the disorder. So when you see your doctor, they don't have a chance to walk in, talk over you, talk down to you, tell you what to do, run out of the door. It gives you a certain understanding so that you can ask intelligent questions. And the squeaky wheel gets the oil. So the more knowledge you have before you even go in to see your doctor, the less likely you are to experience a health disparity. Okay. So arm yourself with knowledge. That's the purpose of these videos. So come on, join the community and join the membership, because the members, there are perks to the membership. I do special members only videos every week. And then once a week, and then once a month, we have a members only live Q&A. So go ahead, click the link in the description. And you can always visit my one-stop shop, drfrita.com, to join the membership and to see what else I have going on. All right. I thank you kindly for your participation. Yeah, it's Heart Disease Awareness Month. So let's just go on and do this thing right now. All right, Shador, shall we move on?
Yes.
I think we shall. Okay. Now, everybody about to age themselves right now. If you know the show Sanford and Son with Red Fox, who, speaking of Heart Disease Awareness Month, Red Fox's character was always like, "Oh, I'm coming home," like to his deceased wife. He always pretended he was having a heart attack. And then his son, Lamont, was just always annoyed with his over-the-top daddy who was politically incorrect on every corner. Well, the actor who played Lamont, Demond Wilson, has passed away at the age of 79 from prostate cancer. Let's play that clip. And then I want you to answer the question. When it comes to health screening, cancer screening, tell me what you do in your everyday life or what you're planning to do to make sure that you're up to date on your health screenings. And what can you put in the chat? Just give me a smiley face. Give me a smiley face and tell me what you do to make sure you're up to date on your health screening. So what you plan to do. All right, let's play this clip.
About the death of actor Grady DeMond Wilson. He was the son in Sanford and Son, one of the biggest TV hits of the 1970s that also starred Red Fox. Wilson died at his home in Coachella Valley, California, of complications from prostate cancer. He was 79. We learned
79, prostate cancer. Now, y'all know we've talked about prostate cancer here quite a bit, and it's actually the second most common cancer among men. It's second only to skin cancer. And what's really striking about it is that Black men are disproportionately affected by prostate cancer. Black men are 70 to 80% more likely to be diagnosed with prostate cancer when compared to white men, and Black men are more than twice as likely to die from prostate cancer. That's a wreck. Also more likely to get diagnosed at young ages, like less than 50. And listen, if y'all been watching me, you know that Funky Dineva, he is one of the original YouTube content creators, and he shared that at his young age of 42, right now, he's living with prostate cancer. And thankfully, he's on top of it. He did not wait for symptoms, because the truth of the matter is, with prostate cancer, early on, you might not have any symptoms. Okay. Early on, you might not have any symptoms. By the time you get symptoms, like perhaps blood in your urine or blood when you are having romance, or, you know, with your ejaculation, having blood, or if you get pain in your back, or, you know, some symptoms that you may have some spread of prostate cancer. By the time you get these symptoms, weight loss or bone pain, then it's very late in the disease. So you want to make sure that you get screened for prostate cancer. And there have been some changes over the years as far as when screening is recommended. I'll share with you what the American Cancer Society recommends. If you're of average risk and you're a man, or you're born as a man, born with a prostate, then the recommendation is by the age of 50, have a discussion with your doctor for shared decision-making for screening. However, if you are at high risk, then by 45, that's when this conversation should occur. And here's a spoiler alert. If you are a Black man, you are automatically at high risk, period. You're automatically at least at high risk, period. Also, if you are a man with a first-degree relative, like a father or a brother who was diagnosed with prostate cancer before the age of 65, then you're also considered to be high risk. If you are at very high risk, then it's recommended that you have the discussion about screening by the age of 40. And you're considered to be at very high risk if you have at least 2 first-degree relatives. So if you have a father and a brother, or if you have 2 brothers, okay, 2 first-degree relatives who were diagnosed before the age of 65. And, you know, some of the screening, PSA, prostate-specific antigen. Also, you can get prostate ultrasounds. Prostate MRI, I will just give my bias on that one. That's one I've been getting very good results with, the prostate MRI. And, you know, you talk with your doctor about the risk versus the benefits of the treatments. Prostate cancer is a slow-growing cancer, but it can grow. So make sure that you are upfront. Please don't be scared of getting bad news, because the only way you can deal with bad news is to tackle it. The only way you can deal with it effectively. All right. Did anyone in the chat share what you're doing to stay up to date on your cancer screenings?
Absolutely, Dr. Frita. Let's see here. I can see clearly. Hey.
I can see clearly. What you doing?
Regular mammograms, colonoscopies, and endoscopy for GERD.
I'm all the way with you. And of course, the endoscopy is not going to be a routine screening for cancer. That's going to be individual if you're someone, like you said, with GERD, gastroesophageal reflux disease, or heartburn. But just the general recommendations for mammograms, no later, women, by the age of 40, should you be having the conversation as far as getting your mammogram, preferably a 3D mammogram. Okay, more and more centers are presenting a 3D mammogram, which is actually more sensitive than the 2D mammogram, the traditional mammogram. So at least by the age of 40 every year. But if you have a family history of breast cancer, or if you have a lump in your breast, or if you have some discharge from your nipple, or your nipple looks eczematous or scaly, okay, or if you have a change in the texture of your breast, if they start looking like peau d'orange, like the skin of an orange peel, if you have lumps in your underarms, okay, then never mind waiting till 40, you go and get a diagnostic mammogram. Also, if you have a family history, have the conversation with your doctor. But for example, if you have a relative, like if your mother got diagnosed with breast cancer at the age of 40, then it's likely recommended that you start screening 10 years earlier than 30. But consult with your doctor to find out what's recommended for you. But yes, keeping up with your yearly mammograms. Once you get to a certain age, then it again becomes a shared decision-making process with your doctor on whether you're going to be 75, 80 and still getting screened. But that's an individual decision, but very good on the mammograms. Colonoscopies. We used to say, oh, let's just, get colonoscopies by the age of 50. But now that age for screening, that recommendation has gone down to 45. And so if you are listening to the sound of my voice and you are 45 or older, then it is recommended that you have had your colonoscopy. I have a video right here on YouTube also talking about colon cancer, keeping Nene Leakes, here. We know that her late husband, Greg Leakes, actually passed away from colon cancer. And one thing I did like about him is that he was honest. He said he didn't want to get a colonoscopy. He didn't want anything going in his rectum. Okay. He didn't want anything that will make him feel like less than a man. And that might sound silly to some of you, but it's a real thing in some of this bro culture, especially affecting the Black community. A lot of men don't want prostate screenings. They don't want colonoscopies. There's this big thing on, oh my gosh, I don't want my masculinity to be, questioned. So Greg Leakes, he was definitely an intelligent person. There was no question about that. But it just lets you know how some of these barriers to health are just really prevalent in different communities. So make sure that if you're 45 or older, if you have a loved one who's 45 or older, please go right up in their face and make sure that they had their colon cancer screening, colonoscopies. And typically anywhere from every 10 years to every 5 years, depending on if you have polyps. All right, good stuff. Anybody else?
Yep, our members are chiming in.
Come on in, members. Come on in. And y'all make sure you give us a like, a follow, a subscribe. We're here giving you evidence-based information, and we love to do it. All right, memberships has its privileges. Make sure that if you want to be a member, and I did a members only video for y'all this weekend also. I do a lot of shorts, like short form content, and I usually have to cut it down to actually make it a short because surprise, surprise, I like to talk. But when I have those extended versions, sometimes 5 minutes, 6 minutes, 7 minutes, members, you'll get a chance to go in and see every single detail that I really want you to know about the different health information. For my most recent members only, I have a short form right here on YouTube. You can check out the short after you finish this live on the 7-year-old girl who overdosed on her mother's GLP-1 injection. But I also, for members only at the resident level, you get to see the full conversation that I have about that. Okay. What we got going on, members?
Ms. Rosalind says she's keep her routine annual visits.
Good. Very good, Ms. Rosalind. So seeing your primary care doctor and then going over what is important for cancer screening. That's good.
Absolutely. And then Donna Michi, hello.
Hello, Donna Michi.
Says I encourage my spouse to monitor each annual visit.
Encourage your spouse to monitor each annual visit. That could be a good strategy because if they're monitoring your annual visit, that'll force them to also remember themselves, and then of course, just keeping each other accountable. That's good. Thank you, Donna Michi.
All right.
Very good.
I see you, Nate, one outside of the colonoscopy and the mammogram.
Now, what you have to say, Miss ICU?
The dentist every 2 years. I think they have now when they can scan for oral cancer now at the dentist.
Do you know what? Let me tell you something. ICU girl.
Mm-hmm.
I am very happy with you. You sit right by me at the front of the classroom because we often overlook dental health, don't we? But do you know that having dental caries, like infection in the mouth or gums that are inflamed, that can increase your risk for inflammation, for heart disease. If you have a bad tooth, as they call it, or a sore tooth that you ignore, do you know that from a mouth infection, that can actually lead to a brain abscess? A mouth infection can actually lead to you getting infections on your heart valves, endocarditis, which is potentially fatal. And so I'm glad you brought that up. We should not miss our dental health. Okay. Every 6 months, I know I go and sit up in the office and get my teeth cleaned and fuss and complain. I'm not that bad of a patient, I don't think. But talk to your dentist, talk to your doctor about how regularly you should be getting your teeth cleaned. And definitely, if you have dental caries, dental infection, if you need a root canal, if you need a tooth removed, if you have a dental abscess, don't ignore that. Beyond your dental health, it can affect your whole body. So thank you for bringing up the dental health.
Mm-hmm. And she also mentioned,
like you said, oral cancer. Oh, go ahead.
Yeah, also mentioned eye exam yearly and her endocrinologist yearly. She had thyroid cancer survivor. So
oh, bless you.
Yearly in her eyes.
I love it. Come on up to the front. Thank you very much. All right. That's good stuff.
All right. Thank you. I see you, girl.
That's cool. All right, y'all. Make sure you give us a like, a follow. Listen, y'all pause. Get y'all smartphones. Go into your WhatsApp where you were just talking to your family this morning. Drop the link, hit the share, drop the link, tell them, come on, join us. Go to your group me where you were just talking to your line sisters and your frat brothers. Go tell them to come join us. I want you to go where you were just talking to your mama and your daddy, asking them if they're keeping up with their appointments. Put the link over there and tell them to come join us. Let people know you're here because that does affect our algorithm here on YouTube. We're giving you evidence-based information and we're having fun, I believe. I'm having fun. You know how else we're about to have some fun? We're going to play my favorite little game, myth versus fact. All right, so y'all get your pencils out. Myth versus fact. And today's myth versus fact segment is going to be about the now late actress, Catherine O'Hara. And can you believe she passed away on the same day as Demond Wilson on January 30th? And her specific cause of death, I don't know if that's been disclosed, but there is something that has been disclosed, and that is that she had a very rare condition called dextrocardia with situs inversus. And that's when instead of your heart being on the left side and your liver being on the right side, everything is reverse, reverse, reverse. And so then your heart is on your right side, your liver is on your left side, your spleen is on your right side, your gallbladder is on your left side. It's reversed. And so she actually didn't even discover that she had this condition until later. But let's go ahead and play a little game, myth versus fact. Situs inversus. Was this the cause of her death? All right, myth versus fact, statement number one.
All right, statement number one. Situs inversus usually affects how well the heart functions.
Put an M1 if that's a myth, and F1 if that's a fact. The situs inversus affect how well the heart functions. All right. Myth versus fact, statement number two.
People with situs inversus typically experience serious health problems throughout their lives.
All right. An M2 if this is a myth, and F2 if this is a fact. Pencils down. This is my favorite little game. Did any med heads participate? I know our members did. What you got?
Yes. All right. So the majority are saying myth. I do have one say fact. So Erica,
okay,
that is a myth. And I restate the question. Situs inversus usually affects how well the heart functions. So Erica says myth.
All right, Erica. We'll see. We'll see. I'll be the judge of that.
I see you, girl. It's new, Dr. Fisher, her first live, so she's very active today.
Hey, I love that you're here. I see you, girl.
Says myth.
You think it's a myth? Oh, dear.
KK says a myth.
Okay. Okay, you say it's a myth also. So you don't think it has anything to do with how your heart functions? Okay, who else?
I remember Miss Rosalind agrees, a myth.
Thank you for being a member, Miss Rosalind. Okay.
Sheila says a fact.
Sheila says it's a fact. I mean, I guess you would think if everything is reversed. I mean, hello, it's reversed. Could that really be normal? Okay.
Miss Katrina also says it is a myth.
Hi, Miss Katrina.
And Purple Onion says fact as well, Dr. Frita.
Okay, who else said fact?
Purple Onion.
Purple Onion. Hi, welcome, Purple Onion. All right. Do you know I love purple onions in my salads? I'll get like arugula, purple onion, olives, not too many because they can be a little salty, feta cheese, a balsamic vinaigrette dressing, and oftentimes a grilled salmon. So purple onion, do understand every time your name comes up I get hungry. And purple onions are wonderful. They have all kinds of anthocyanins, phytochemicals that are anti-inflammatory. Purple onion, this me digressing is your fault, purple onion. All right.
Well, Dr. Free, why you digress? Sheila, thank you for your super chat.
Thank you. Thank you, Sheila. And do you know what? We had a couple super chats we missed last week. I don't know if you still have them in the queue, but I appreciate you. And I didn't realize it till the live was over. Those of you who give the super chats, I appreciate that little extra. I appreciate you very much. All right. Thank you. All right. So myth versus fact. This is a myth. This is a myth. Even though the heart is on the opposite side in the dextrocardia, okay, the heart on the right, it actually does not affect how the heart functions. Yeah, that's it. That's a simple answer. Okay. Myth versus fact statement number 2.
Yes, ma'am. Number 2. People with sinus inversions typically experience serious health problems throughout their lives.
Okay. What say you?
Mr. says it is a fact.
Okay. Okay. And if using common sense, it does seem like if everything is completely reversed and turned and twisted, it would seem like that. Okay. Like a common sense kind of thing. Let me see what else y'all say.
Michelle says it is a myth.
Oh, Michelle, you think it's a myth. You think it's just reversed, but it's still working. Reverse. Okay.
Lisa says a myth.
A myth. Okay. Hi, Lisa.
Esther says a myth as well.
Hi, Esther.
Sheila says a fact.
Okay. Sheila's like, I'm not with this heart on the right side and liver on the left. Okay.
Yolanda agrees it is a fact.
A fact that if everything's twisted up, then it's probably jacked up. That's the term, jacked up. Okay.
And Ario, excuse me, Ario says a fact as well.
A fact. Okay. Okay.
Let
me tell you, I love this question because we're talking about Catherine O'Hara from Home Alone, from, what she was a voice of Sally, Night Before Christmas, a comedic actress, I believe. Yeah, she was a Canadian American, mother of 2, pretty neat lady. And we're talking about her death, and I'm talking about sinus inversus, but actually sinus inversus was likely not the cause of death because this is a myth. People with sinus inversus in general don't have more complications. They just simply have a reversal of their organs. The heart that's normally on the left is on the right. The liver that's normally on the right is on the left. The spleen that's normally on the left is on the right. The stomach that tends to lean toward left is toward the right. They have a reversal, and they typically have no issues more than the average person. And with Catherine O'Hara, she wasn't diagnosed until she was in her 40s with sinus inversus, not because it was causing a problem. It was just an incidental finding on some imaging. And they're like, wait, all your organs are in the wrong place, basically, or the reverse place than what's the norm. So she just happened to find out after over 4 decades of life. So isn't that just interesting? So we're not saying that she passed away from sinus inversus. It just happened to be a very rare condition that she had. Yeah, most people are perfectly fine. Just one of those things. I think a lot of people haven't heard of it. When I did my residency at Georgetown, of course, we used to discover it for kids who had x-rays, whether they were in the NICU or just, in the hospital on the pediatric floor. And I only saw one person in my whole time who actually had the sinus inversus. And that's the type of x-ray that you save and everybody comes and they look at it because it actually is quite rare. Yeah, just one of those interesting medical facts. All right. Well, y'all make sure you give us a like. Are we having fun yet? Give us a like, give us a follow, give us a subscribe, if you will. And let me tell you what we're doing over here on this YouTube channel. We have over 963,000 subscribers right here on the Dr. Frita YouTube channel. And it's all because of you. And I thank you. And that means we're marching toward 1 million. Okay, 1 million. So please, if you have not subscribed, go ahead and hit that subscribe button. It means so much to us over here. And make sure you share And if your loved ones, your friends, heck, even send it to your enemy, I don't care. Send these videos, send this link, let them know we're here, because honest to goodness, we're sharing evidence-based medical information meant to help people to be advocates for themselves, for your family members to advocate, and just to give you good knowledge, not all these hacks and crazy things that you might see on social media. You're talking to someone who has actually gotten multiple board certifications. And I'm not kidding when I tell you, I read or listen to medical journals every single day so that I can stay updated to come here and to bring you accurate information. Okay. All right. And while you're giving us a like and a subscribe and all those things, if you want to talk to me one-on-one, uno a uno, okay, then I do offer a telehealth concierge service where you can just come. I can get a full history. I can talk to you from anywhere in the world about whatever medical problems you might be having. And remember, I am board certified. I'm a board certified nephrologist, internist in obesity medicine. I have been board certified in pediatrics. And so I have a wide range of topics I can talk to you about. So come on, we're having fun. I've really have had some good success with these concierge visits from people from all over the world. No joke. All right. Well,
before you transition, shout out to our 2 newest members just that joined us.
Come join our party. Now, who are our members? Come on here.
They are James.
Hi, James. Thank you for joining the membership.
And come back here. Alice.
Thank you. Thank you. Welcome. Welcome to our membership community. And again, we'll definitely give you your special emojis here. We'll give you your shout outs and your priority when in answering questions and comments and asking questions right here on the lives. And then if you're at the resident level, I do members videos just all throughout the week. I do members only videos. And then at the chief resident level, then once a month, I have a members only live Q&A where you have just a tighter access to me, where all I do is answer your questions. And you can come up on stage and all of those things. So thank you for joining. I appreciate that support. I know you don't have to do it, and I appreciate that you chose to support in that way. Cool. I like it. All right, let's talk about more trending medical headlines. Like, why not? Okay. All right. I want to talk about Real Housewives of Potomac. Okay, for those of you who've been following me for a while, y'all know my guilty pleasure that I'm not guilty about is watching different reality shows, including Real Housewives of Potomac. Karen Huger, an OG, been watching her since day one. Honey, she can read like a librarian. She will tell you off, but she did have a bit of a snafu in her life, to put it very lightly. She is someone you'll recall who was found on tape. She had a DUI. Okay, she was driving under the influence, and the video footage really caught her when she was inebriated. She doesn't actually remember these things happening, but she said just a lot of things and was slurring her speech and was just altered to the extreme. And as it turns out, she's had 4 incidents with alcohol while driving. We've called them 4 DUIs on a technicality. I believe 2 were officially DUIs, 2 were incidents of her in a vehicle and under the influence. Either way, a lot of alcohol use. And she has admitted to having a lot of alcohol use, but it was to the point where she actually went to jail. She sure did. She did. And so now she's been released. And 1 week after getting out of jail from having this DUI, she did an interview with Andy Cohen. And so I do want to play that, and then I'll ask y'all a couple of questions of my own. All right. Do we have that clip?
Incidents involving alcohol.
Okay.
2 of them were not DUI.
Okay.
And the oldest one is 20 years old.
Yes. I want to go back to the day that you were sentenced.
Yeah.
Were you surprised by the severity?
I was shocked. I knew I was going to jail.
Okay.
I had made peace with that. But I thought maybe a month. No more than 3. But this was just one more step toward accepting my responsibility for what I did.
You were released much earlier than your original sentence date, up to a year in jail. How were you able to be released so early?
Well, I went to work immediately. I took full responsibility for the accident and driving under the influence. And I asked them, how could I volunteer? And so when I worked, it worked the time down.
And so what kind of volunteering were you doing?
Well, I actually led the NA class and the AA class.
Forgive me, but...
Incidents.
Okay.
Okay. So if you watch that full interview, it's on Bravo, it's available on Peacock. You'll see that the first part of it is her the day she gets released from jail. And, she goes home, she's talking to her family, and then a week later, he does the interview. And Andy actually asks her about, is she an alcoholic? And she says that, she was addicted to prescription medications. And he's like, are you an alcoholic? She's like, well, I've lived and there's been alcoholism. She kind of dances around it a bit, which, can make some people wonder, does she have accountability? And I do believe she has a level of accountability, but the interview was just 1 week after getting out of jail. I would love to see how she's doing now. But, when he says you have 4 DUIs, she's like, let's be clear, there were only 2. The other 2 incidents involved alcohol and driving, but I wasn't charged with a DUI. That's a distinction without a difference as far as I'm concerned. Legally, I know there's a difference, but as far as having an issue, either way, I'm pulling for Karen, and I do thank God that she didn't actually kill anyone with any of those incidents with alcohol, because that's the real picture that she could have, but she served her time. She's in therapy, she's in counseling, and I just, really pray moving forward that she will have a hold. And so I do want to talk about some of the dangers of alcohol, because that's really, it is like the most accepted substance in town. You go to a birthday party, there's alcohol. You go to a baby shower, there's alcohol. You go down to the wherever, hey, you want something to drink? And so for people who are trying not to drink, often if you say, I don't drink, you're looked at like a pariah, like, what's wrong with you? Why don't you drink? And so it's a substance that is legal, but actually alcohol overuse is really a high cause of morbidity and mortality. And so let's talk about some of the dangers of alcohol. And while we do, I want you to put a little beer emoji. Yeah, that's right. Put a beer emoji. If you just type in beer, the emoji will pop up on your smartphone. Y'all know what to do. But put a beer emoji in the chat and then answer this question. Outside of alcohol or substances, what activities do you do to relieve stress and anxiety? Okay. Outside of alcohol or substances, what activities do you do to relieve stress? Let's give some folks some idea especially if they're trying to cut back on different substances that they're using. Okay. So as far as alcohol, the dangers of alcohol, what alcohol does is it definitely can alter your mental state. It does alter your mental state. When you drink it to the level of becoming inebriated, it can decrease your inhibition. Okay. So instead of you kind of having a checks and balances on your behavior, perhaps not saying something in a rude manner, or perhaps not picking up something and throwing it at somebody because they make you mad, the alcohol can decrease your inhibition. And so you might be more violent, or you might be more violent with your words and more insulting, and that could cause a problem. It can also take away some of your impulse control. You might run and jump and do things that are impulsive and they end up being dangerous, including grabbing the keys to your car and speeding somewhere under the influence because you don't have the control of the impulse to do that. You're not thinking and doing the checks and balances. And it can also, it can decrease your inhibition as far as what you're eating. That's kind of from an immediate health standpoint. It can lead you to overeating because you're not going to inhibit yourself from eating. And so it can make you make poor choices. Have you noticed that if you ever had any kind of alcohol where you're a little buzzing, all of a sudden, you know what? I was trying to cut back on my carbs, but hey, that cake is a good idea. This popcorn is a good idea. Ooh, let's eat all the steak. It can make you, it can be set back on some of your health journeys as far as eating is concerned. And then when we talk about long-term damage, of course, long-term alcohol overuse can lead to liver disease, liver failure, liver cirrhosis, things of that nature. It can lead to esophagitis, inflammation in your esophagus, that tube that connects your throat to your stomach, and gastritis even. It can lead to hypertension, portal hypertension, like in your blood vessels and the liver, and that can lead to getting esophageal varices, or big veins in your esophagus. That might sound like no big deal, but it's potentially fatal, because if one of these esophageal varices, these veins inside the esophagus, if it bursts, I remember seeing this in the hospital, and you're vomiting up blood, it can go quickly and patients can die from that. And of course you can get encephalitis, hepatic encephalitis from long-term alcohol overuse, Wernicke syndrome, heart failure. Alcohol overuse can lead to dilated cardiomyopathy and congestive heart failure. Hello, Heart Disease Awareness Month. We know that when Ray J shared that his heart was working at just 25%, I don't know if this is the cause, but he does share that he used to drink bottles, plural, of alcohol per day. In addition to using substances, he said that he used Addy, I guess it's Adderall. But alcohol overuse can lead to congestive heart failure, can lead to dilated cardiomyopathy, and certainly increase your risk for congestive heart failure. So yeah, so these are some of the health consequences. And so now, did anyone in the chat share what kind of things outside of alcohol or substances that you do in order to de-stress?
Absolutely. I start with our members, Miss Rosalind.
Look, they put a beer emoji.
Yeah, well, she didn't, but we did have some beer emojis in here.
I am Miss Rosalind.
She says, go by the water.
Go by the water. That's so funny. I was just talking to one of my good friends, my line sister, in fact, and just telling her that in times of stress, that's kind of my go-to. Just even if I can't physically go by the water, to me, the image of me being in nice, clear, cool water with warm sunshine, that's something that's de-stressing. And that gets into one of the visualization techniques that I'm talking about that can help to lower your blood pressure naturally. Make sure that after you finish watching this live, you check out my YouTube video from a week or so ago where I talk about 5 tips. Not even 5 tips, just some 5 common things that might look like hacks or things you might have seen, like dipping your face in ice water, visualization techniques, slow, deep breathing. And I give you the evidence, I give you the science behind it on whether they work or whether I think it's a bad idea, because I don't think all of them are a good idea. But I like the visualization techniques. That's a spoiler alert. Okay, thank you, Ms. Rosalind.
James, member James.
Hi, James.
Thank you for being a member. Walk, practice self-control.
That is good. That's good. Prayer. And I like that you have that physical activity. And when you're walking, especially when you're walking alone, that does give you a chance, right, to really just have your one-on-one conversations with your higher power. So that's good. Yeah, very good.
Diane on Facebook says deep breathing.
Come on to it. That's very good. And we do have some science behind that. And that's in that video I was talking about. Either the diaphragmatic breathing or the belly breathing, or that 4-7-8 method where you breathe in for 4 seconds, hold it for 7 seconds, and then you breathe out for 8 seconds. So these are things that can help to decrease stress. They can help to slow your heart rate down, dilate your blood vessels, help to kind of reduce some of those stress hormones like cortisol. Slow, deep breathing. Okay. That's one that I actually utilize. And look, and when I have folks call me and they're stressing out, I say, okay, let's hit it. 4-7-8 for the breathing. Okay. That's a good one.
Erica named a few.
Hi, Erica.
And she put her beer emoji. So Erica says,
hey, Erica. Thank you. Yeah, I like my emojis. Thank you for humoring me. Okay. What you got?
A workout, dance, take walks, talk to family and friends.
Love it. Definitely the exercising, the dancing will release endorphins, and that can help to reduce your stress. The socialization can help to reduce stress, reduce anxiety, and then being in the comfort zones of talking to people you consider to be safe spaces, be it family, be it friends, people you trust. Those are excellent ways to decrease stress. I love it.
And then Ms. Glenda, a little bit of hindsight. She said, be determined that I would not like to have outcome of alcoholics or substance abusers. So just the sight alone of knowing those people or what can happen when you're addicted or abusing substances or alcohol. So she just determined that she don't want that outcome.
Very good. And I will say with that, some people are able to do it with determination, but for those who are not able to, addiction is a disorder. It's a disease. I know some people think, oh, y'all all the time making excuses, but there are certain people who are more predisposed to having addiction, okay, be it because they came from an environment like the social environment or physiologic. We think that there are physiological links that will predispose people, and it also can depend on the dopamine receptors, the reward pathway. Once y'all finish watching this live, I have a video. If you put in the search bar of YouTube, Dr. Frita addiction, I go into the science of addiction. Okay. And beyond alcohol, it can be food addiction, it can be shopping addiction, it can be sex addiction. What? Do y'all remember who said it? I think Usher said he had a sex addiction. There's a such thing, but sometimes I think folk be playing too. But anyway, all right. But yeah, so just praying that Karen Huger does well, and I'll definitely continue to be watching her and supporting her, because I think she's bold, if nothing else, because all her business is out there, and she's still back on RHOP. All right, please give us a like, ding, click like, subscribe, and let's talk about TK Carter. He passed away at the age of 69. He was an actor he was in The Thing, Porky's, Roots. He was in Roots. His career has spanned over decades, but he was found to have passed away at the age of 69. I know initially in reports, the family was saying that he, died from private battles. I've heard some different conflicting things. TMZ reports that he had systolic heart failure. Okay, so let's play this clip, and then we'll talk a little bit more about TK Carter.
Actor TK Carter has passed away at the age of 69 years old. According to TMZ and their exclusive, they said that Carter was found deceased Friday in his California residence. After a call for service was made, law enforcement tells TMZ the call came at approximately 5:42 p.m. and a death report was made. No foul play is suspected. TMZ reports that the cause of death has not been revealed, but they remind us of his illustrious career, saying that Carter had a decade-spanning career dating back to the mid-1970s, with his big break being in The Thing. Other notable films he acted in included 1985's Runaway Train, 1996 Space Jam, and 2005's Domino.
Okay. So since then, TMZ reported systolic heart failure. And we talked about heart failure extensively, I know, but I will just say that oftentimes there are lots of comorbidities with the heart failure, high blood pressure being one. But with him, TMZ also reported that he had AFib, atrial fibrillation, abnormal heart rhythms. I also saw reports of him having pulmonary hypertension. So just understand, oftentimes these chronic medical conditions, travel impacts, it just reminds you that it's so important to do everything you can for preventive health and face medical problems head on so that you can live long lives with high quality. And so, look, I know I've been talking quite a bit today. We covered a whole lot of things today. I do just want to mention, I'll give you a reference to a young girl, a 7-year-old girl who overdosed from a GLP-1 medication. Okay, she took her mom's GLP-1. She said that she saw her mom doing it for stomach aches, and she thought maybe that will work for her. So she injected herself with 60% of the mom's medication. She had nausea, she had vomiting, she stopped making urine, she couldn't even walk. Her mom had to carry her to the restroom, and they took her to the hospital for GLP-1 overdose. And so I just want to remind you, for if you have children, these kids are smart, okay? And they are nosy and they pay attention. And if you have medications, it's important that you keep them away from your kids. You can go online, you could order yourself a medication lockbox, something that you can keep in your refrigerator or keep in a corner, but just make sure that you don't assume that your kids are not going to be curious. They mimic us, okay? So make sure you protect your children. And I will tell you that this little girl, she's 8 years old now. She's doing fine. She recovered, but it was touch and go. She nearly died from the overdose. And it's not just little kids who overdose from GLP-1s, okay? Adults do it too, usually adult women, and the amount of overdoses has skyrocketed. Let's just play a little piece of this clip, and then I encourage you all to check out my short right here on YouTube and on some other social media platforms where I go into detail about GLP-1 overdose, how to watch it, how to prevent it.
With those GLP-1 drugs, Indiana's Poison Center reports a spike in overdose calls. Our 13 Investigates reporter Sierra Putman found a family who wanted to tell their story and show what can happen.
7-year-old Jessa is wheeled through the hospital. Ashen, exhausted, in pain, and hooked up to an IV, admitted after taking her mother's GLP-1 medication.
But I don't think we were prepared for how bad it was going to get.
These images bring back terrible memories, but Melissa Mylander hopes they can also bring awareness of what can happen with a GLP-1 overdose. Doctors admitted the 7-year-old to the hospital days after she self-injected her mother's medicine. Medical records show Jessa was vomiting and was admitted to the ER for rehydration. An IV drip and medication stopped the worst of the symptoms, so doctors sent her home.
Yeah, but then she had to go right back because she stopped making urine. But again, that little girl is doing well, but allow that to be a cautionary tale to keep your medications, all medications, out of the reach of children. And for adults who are on GLP-1s, some of the causes of overdose are people forgetting that it's a once a week injection. Okay, these GLP-1s, and they might inject themselves every day. That can lead to overdose. If you have a compounded version of the GLP-1 that doesn't have like a pre-dosed pen and you have to pull the injection out yourself, some people will accidentally pull too much and that can lead to an overdose. And some people on purpose will give themselves a higher dose thinking more is more, and that can lead to a problem. But yeah, it can lead to pancreatitis. It can lead to kidney failure. It can lead to you not being here if you overdose. And more, the number has gone up something like 1,500% as far as calls from GLP-1 overdose. So please just make sure if you're taking a GLP-1, you use it as prescribed and under the supervision of a physician. I am a board certified obesity medicine specialist, and I do prescribe GLP-1s when indicated. If you care to have an appointment with me, make sure you click the link in the description or go to my one-stop shop, drfrita.com, to book a telehealth concierge appointment, and I can guide you if GLP-1s are indicated for you on how to use them safely and effectively. All right, and let's just play one more quick story before we slide out the door about measles.
The measles. Right.
Concerning situation in Florida, potential measles cases believed to be linked to a university near Naples. Hannah Batas joins us with the very latest as health officials monitor this. And good morning, Hannah.
Yeah, good morning to you guys. This potential outbreak is on the southern end of Florida's Gulf Coast. At least 20 cases are believed to be linked to Ave Maria University, a small private Catholic university. County government said in a Facebook post that it is providing free MMR vaccines. Neither the Florida Department of Health nor Ave Maria University have answered repeated calls and messages from ABC News regarding this situation.
And they're in South Carolina, measles vaccination rates are the highest they've seen in years.
Right, and that's due to a separate outbreak, Michael. This South Carolina state is experiencing a record-breaking measles outbreak that just continues to grow. Health officials there say about 95% of those infected with measles are unvaccinated. Many hospitals in the state now requiring visitors to mask up to contain the spread. 7,000 more doses of the MMR vaccine were given last month compared to January of last year. Spartanburg County, along the North Carolina border, is the epicenter of the state's outbreak. There, the county experienced a 162% increase in MMR vaccinations in January compared to January of last year.
All right. So it's just a reminder, just because we're not over on the Dr. Frita Live talking about it every week, please don't forget about the measles outbreak. You will recall that we had eradicated measles here in the United States back in 2000, because if you get 2 doses of the MMR, the measles, mumps, rubella vaccine, just 2 doses, you have a 97% chance of never getting the measles. Yay. But now, because of so much disinformation, largely spread from the administration, RFK Jr., we know that he's a known vaccine critic. And if you don't get this MMR vaccine, then you are at very high risk, because the measles is highly contagious, highly contagious. One person can infect an average of 18 people. And if you don't have the measles vaccine and you're exposed to measles, you have a 90% chance of getting measles. It's not just as simple as, a little fever, a rash. Children have passed away this year from measles. We've had thousands of deaths from measles. Over 32 kids have passed away from measles, and something that was easily preventable with the vaccine. And it's not even just death. That's not the only consequence of measles. There are long-term effects that you can have. You can have an issue with encephalitis. You can have a long-term subsclerosing brain disorder with it. It can leave you with debility. And is it worth it? No, it's not. The MMR vaccine is safe. It's effective. There is no proven link between MMR and autism. And it's just frustrating. This is old news, but new disinformation is causing people to die. Please consult with your doctor and get your measles vaccine. Don't become a statistic. All right. So what's that? Any questions before we slide out the door? Okay.
We got 2 new members.
Yay! Y'all come on in. All right. Thank you.
Ms. Gail.
Hi, Ms. Gail. Thank you for joining. Sheila joined.
Yes.
Come on, Miss Sheila. Thank you. I appreciate y'all very much. Make sure, depending on your level, you check out the members only videos that we have, members only live Q&A, or just come hang out and get your special shout outs. I appreciate y'all for the support. And just make sure that you keep coming back here and joining. We'll give you medical, evidence-based medical information. You can go to my one-stop shop, drfrita.com. Also, join me on all social media platforms when I'm doing different shows like national news shows, be it Don Lemon or News Nation or Paternity Court or, oh gosh, I've had things on Revolt TV. I've had all kinds of things, 11 Alive News, Atlanta News First. If you go to my playlist right here on YouTube, television appearances, you'll get a chance to see the different things that I've done. And also make sure that you check out my book, Under Pressure, A Guide to Controlling High Blood Pressure. And that's a way where I talk about not only traditional ways in treating blood pressure, like with medications, which I do prescribe medications, but also using food as medicine, lifestyle as medicine, okay? It's an integrative approach to lowering blood pressure. All right. I appreciate y'all for hanging out with us today as we talked about the latest trending medical headlines and celebrity health news. Make sure you join us next Monday, same bat time, same bat place. And thank you for making Monday your healthiest day of the week.